Today on Face the Nation, we'll find out in a matter of hours, do the Democrats have the votes to pass health care reform?
We are going to get this done.
We're about 24 hours from Armageddon.
The House will have an up or down vote on the Senate health care reform bill sometime today. Do they have the 216 votes they need to pass it? We'll ask the men who are tracking the votes. House Whip James Clyburn of South Carolina and the key political strategist Chris Van Hollen of Maryland. And if it does pass, can Republicans then stop it in the Senate? We'll talk with the Republican leader there, Mitch McConnell of Kentucky, and Democrat Dick Durbin of Illinois. I'll have a final thought on an anniversary we should not forget. But first, counting the votes on Face the Nation.
Face the Nation with CBS News Chief Washington Correspondent Bob Schieffer. And now from CBS News in Washington, Bob Schieffer.
And good morning again. So today is the day the House will finally vote on health care reform, and a year-long debate that's been rancorous and mean from the start turned even nastier yesterday. Demonstrators protesting the bill poured into the halls of Congress shouting, "Kill the bill," and "Made in the USSR." And as tempers rose, they hurled racial epithets, even at civil rights icon John Lewis of Georgia, and sexual slurs at Massachusetts Democrat Barney Frank. Other legislators said the protesters spit on them, and one lawmaker said it was like a page out of a time machine. One of the lawmakers who saw all this is the chief vote counter for the Democrats, Jim Clyburn, who is at the Capitol this morning, still working the hallways for votes. He's with the Democrats' chief political strategist, Congressman Chris Van Hollen of Maryland. Congressman Clyburn, before we talk about this, do you have the votes? What about these demonstrators yesterday? Have you seen anything like this in recent times?
No, not in recent times. Thank you so much for having us. Last time I saw anything like that was back in 1960. I celebrated a week ago the 50th anniversary of the march in Orangeburg that I helped to organize, the so-called Orangeburg 7, of which I was one. Three of us got together with some students last Monday to talk about those experiences, and we were telling those students how this kind of stuff was behind us. I suspect that I might have to modify some of that after yesterday.
I think I should add that Republican leaders this morning, along with Democrats such as yourself, have denounced these demonstrations. But be that as it may, it just shows how hot tempers are and how volatile this whole situation has been. Congressman Van Hollen, the two of you have been tracking these votes. Where are you right now, do you think?
Well, Mr. Clyburn is the whip, and he informs me that he's absolutely confident that when the vote comes, we will have the votes to get this done. What we've seen is in recent weeks and months, as our members have gone back to their districts and talked with their constituents, they're getting the very clear signal that the status quo is unacceptable. We have a system where the health insurance industry continues to increase premiums by huge amounts, turn down constituents for coverage based on pre-existing conditions, find little fine print in health care policies to deny access to care when people need it the most, and that the status quo is just unacceptable. Well, and that has built this consensus to get this done.
Mr. Clyburn, from the beginning, the Democrats have been saying, we think when this finally comes to a vote this afternoon, we will have the votes. You don't have them yet, though, do you, in all honesty?
Well, you know, in doing vote counting, you try to sometimes work backwards. You look at what it is that you're dealing with, and then you look at the members who have issues that you must reconcile, and you start counting back. That's the way that I do it. And we do believe that the issues that are of concern to people, you know, like racial disparities in health care, we have been talking about that. But it's been regional disparities that has caused us the problem in this health care bill. And we are trying to make sure that we reconcile those differences in such a way that every state, every community feel that they are, in fact, getting a just return on their investment. So these little issues have caused us to really be very, very careful as we move to the final vote. And that's why we are not going to talk about that 216 number until such time as we get to the floor.
Well, by our CBS count, we put you at having as, maybe as few as 204 votes, but maybe somewhere around 210, which would mean you're about 6 votes short now. But there's about a dozen votes, it would seem to me, that are in play. Mr. Van Hollen, why is it that House Democrats are so wary of voting for this bill that the Senate has passed?
Well, first of all, Bob, we're going to get the votes to go over the top. But the reason the Senate bill created some controversy is there are some things that shouldn't have been in the original Senate bill. For example, the Nebraska deal and some other deals. We're getting rid of those. We're getting rid of the Nebraska deal. We're getting rid of the deal that was in there for Florida and New York. We're making other improvements to this bill to make sure that coverage is more affordable. And that's why our members are now very comfortable voting for the Senate bill as amended, as going to be amended by the reconciliation bill. And that's the package. And we're going to have a majority of votes to get that done. And as I said, it is a whole lot better than the status quo when it comes to health care.
Just for those who don't follow this as closely as we do here in Washington, the basic deal here right now is you have made a decision. You're going to vote on the Senate bill, even though many in the House don't like it. You're going to take an up or down vote on that. And then, as I understand it, next you will vote on what is called this reconciliation bill, which corrects a lot of the things in the Senate bill that House members don't like. And Mr. Clyburn, what about those in the House? And I know you've had problems. There are about a dozen that were very concerned about that this Senate bill does not go far enough on abortion, about prohibiting public funds and these insurance plans from covering abortion. I'm told now that the president is going to issue some sort of an executive order that you hope will satisfy that group of people. And where is that? Is that settled yet?
No, I don't think it's quite settled yet, but I think it will be about late afternoon. Bart Stupak and I spent a lot of time together last evening. I've seen him on one of the networks this morning saying that we are very, very close, and I think that we'll be there by the time that we vote. And I fully expect that we will get the votes that are necessary.
You do expect to have his vote. Now, let me ask you this about these reconciliation corrections. Are you satisfied that these corrections will pass parliamentary muster when they go over to the Senate? Because, as you well know, the Senate parliamentarian has to rule on whether they are germane. And if they are, they have to have something to do with reducing the deficit. Mr. Van Hollen, are you telling your people that this can work? And how do you have the assurance that the Senate will actually pass this reconciliation part? Because I know that's one of the things that a lot of people in the House are worried about. They're afraid that the Senate will just turn its back on that, and then House members will be left out there on a limb having voted for something they really don't like.
Well, we are confident it will work, and Harry Reid, the Senate leader, came over to address the House caucus yesterday. He said he had absolute commitments from a majority of senators to get this done, and it does meet the deficit reduction requirements. In fact, the Congressional Budget Office has said that over the first 10 years of this bill, it will reduce the deficit by $143 billion, and over the second 10 years by $1.2 trillion. So this is more than paid for. It's fiscally responsible. I will say, unlike some of the bills that have been passed in the past by our predecessors, which drove up the deficits, this actually reduces the deficit.
All right, and let me ask you this, Mr. Clyburn. I know some House members are so distrustful of the Senate that they have actually demanded that senators send them a letter with 51 signatures on it, assuring them that if they pass these corrections to the bill, that the senators, those 51, will pledge to vote to approve those corrections. Have you obtained such a letter from the Senate, or will that be necessary?
Well, it's not necessary for me. When Senator Reid came over on yesterday, he told me that he had these ironclad commitments and asked me whether or not I wanted to see the letter. I told him, no, I don't need to see the letter. Your word is good enough for me. Now I know that as an institution, we sometimes distrust the Senate, but the fact still remains that I think there are people of goodwill, and we'll get this done.
Well, when you say you don't need to see the letter, does that say that there is such a letter, that he has collected those signatures?
Well, I don't know whether he's got the signatures or not. I know I was told that a letter exists. Now, whether he was asking me whether or not I needed to see something that was in his possession, or whether or not he needed to get me something before we started voting, I don't know exactly what he meant by that. But I did tell him that his word was good enough for me.
All right, and Mr. Van Hollen, quickly, are some Democrats facing defeat out there, members of the House in some of those marginal districts, if they vote for this bill?
No, they're not facing defeat. What's going to happen, Bob, is this. Once we pass this bill, everyone's going to see right away that all those horror stories are not going to come true. The world's not going to come to the end. It's not going to be Armageddon. They're not going to be these death panels. In fact, they're going to begin to see the benefits. We're going to be closing the donut hole so seniors have more help in paying for their prescription drugs. We're going to make sure that there are lifetime limits on what out-of-pocket costs. So there are a lot of benefits that people will see, and they'll see that a lot of the hysteria and the fear-mongering just was not true.
All right. Well, thank you so much, both of you, for a very enlightening discussion, bringing us up to the minute. We'll be back to get the Republican side of this in a minute. So if this bill does pass the House, it goes back to the Senate, of course, and now we're going to talk to two key Senate leaders, Democrat Richard Durbin, the #2 Democrat in the Democratic leadership in the Senate. He's in Springfield this morning, but we begin with the Senate's top Republican, Mitch McConnell. Well,
good morning.
Good morning to you, Senator. Thank you for coming. It looks like you have your work cut out for you. The Democratic vote counters there just said they believe they're going to have the votes to pass this in the House, so that means this bill and the corrections that the House is going to make go to the Senate. What happens then?
Well, they'll have a tough sell first in the House. They'll have to get their members to vote for the Senate bill, which has the Nebraska deal, the Louisiana deal, the Florida deal, and then they'll have to get them to vote for a second bill, which has even bigger Medicare cuts than the first bill, even more tax increases than the first bill, and its own set of special deals. For example, the Rocky Top vote swap, the deal made to get the vote of a congressman from Tennessee who voted against the bill the first time and is apparently going to vote for it this time. Special deal for a hospital in his district. So the second measure that will come back to the Senate is not exactly free of special deals, and that is the proposal, if the House can pass both these measures, that the Senate will take up next week.
So what will be your tactic? What will be your strategy? Will you just offer a series of amendments to try to just drag this out? What will Republicans do?
Well, it's not a question of dragging it out. It's a question of making sure the American people know what's in it. We'll have all kinds of amendments on the substance, and then, of course, there are special rules that apply to one of these so-called reconciliation bills that will be tested in the Senate. There will be various rulings by the parliamentarian as to whether things meet the so-called Byrd rule, and those will be tested in votes as well.
And the Byrd rule, of course, is that it must be germane to reducing the deficit in order to be considered under this reconciliation plan, which we should underline. The reason that Democrats are trying to do it that way is they can pass this with a simple majority of 51.
That's correct, and it's been used before by both sides. Interestingly enough, though, the only time it's been narrowly partisan when it was used, each party lost the Senate the next year. In '93, we had a narrowly partisan use of reconciliation for the biggest tax increase in history at that time, and the next year my party took the House and Senate. In 2005, we used it for a deficit reduction package. It was narrowly passed on a partisan basis, and we lost the Senate the next year. Most of the time we've used this device in the past, the measure has passed by a large bipartisan majority.
So just walk us through this. Mm-hmm. Well, what happens when it gets to the Senate? Will you, what's the first thing you will do?
Well, I'm not going to announce it today, but we will have a series of amendments on the substance of the bill. That will highlight the massive Medicare cuts, the massive tax increases, and other deficiencies that we think are the reason the American people are against this bill. I mean, what's going on here, Bob, is that the Democrats in the House and Senate are trying to convince their members to basically ignore their own constituents and do something that's highly unpopular, even though the public opinion is pretty darn clear that Americans don't want this.
Do you think at this point you can stop this bill from passing?
Well, I'm not going to make a prediction as to what may happen, but it could end up going back to the House of Representatives for a second vote. They may not be through with it after today. They may get it back if it doesn't succeed in the Senate.
We hear that, you know, that President Obama's put it all on the line for this. He's put his whole presidency on the line to get this passed. It's his signature thing. But aren't Republicans, in a way, putting it all on the line by being totally opposed to this?
Well, look, Bob, this is not about the president, and it's not about the Republicans. It's about the nation's health care. And we have a significant difference of opinion about the direction in which to go. And interestingly enough, the American people agree with us that this bill ought to be put on the shelf and that we ought to start over and go step by step to fix the problems of cost, which is the big problem in the U.S. healthcare system.
So you today, and this will be my final question to you, you are making no predictions on whether you can stop this bill or not. Obviously you're going to try, but you can't say at this point that you think you can stop it.
Well, we know the American people want us to, and we owe it to the American people to do the very best we can to keep this bill from passing so that we can start over and get it right.
All right. Mitch McConnell, thank you for being with us this morning. And now we want to talk to Dick Durbin, Senator from Illinois, who, of course, is the #2 Democrat in the Democratic leadership in the Senate. Senator Durbin, what will be the first thing that you will do if, let's say, that the House does pass this?
Well, of course, we've been working on this for quite a long time, and this last week, Harry Reid, our leader, and Senator Schumer, Senator Murray, and I have really met with virtually, well, in fact, every Democratic senator face-to-face so that we understand the importance of this vote. I listened to Senator McConnell talk about the procedure and the process and the politics, but I think our members are impressed by the substance of our challenge here. If we do nothing, as the Republicans suggest, we're going to see health care costs reach a point where small businesses can't afford it and families can't afford it. We're going to see people turn down for pre-existing conditions. We're going to find the Medicare donut hole, a gap in coverage that's going to hurt a lot of seniors. So when you get to the substance, beyond the politics of the next election, we think this is a clear choice.
Well, let me ask you just a little bit about the politics first. You just heard Mr. Clyburn, the top vote counter, saying in the House, saying that Senator Reid said to him yesterday, do you want to see the letter? And we've been hearing reports that House Democrats were demanding a letter with the signatures of 51 Democratic senators. They're so distrustful of the Senate that they were asking to see a letter with the names of 51 of you on it, assuring them that they would pass the corrections to the original Senate bill that the House wants. Is there such a letter, and will it be given to House members?
Yes, there is such a letter. It has been discussed and with Senator Reid and Speaker Pelosi. She knows and we know that there is a majority to pass this reconciliation bill in the Senate Democratic Caucus.
It's written down on a piece of paper, 51 signatures by Democrats, that if the House passes these corrections, that they will sign that.
Let me tell you, I think there may even be more than 51. The Speaker knows this. She has spoken directly to Senator Reid, and at this point, we're ready to move forward.
So how does this work then? The Senate, the House passes these two bills today, if they do have the votes. What do you take up, and when do you take it up, Senator Durbin?
Understand, health care reform, if the House passes both today, is a law that will be sent to the President. We will have health care reform in America. The reconciliation bill, which the House is, I hope, also going to pass, makes it even better in terms of making it more affordable for families and businesses, closing this donut hole, making sure that we have more health care clinics across America to keep people out of emergency rooms and give them basic care. So we think we're on a path now to pass reconciliation in the Senate. But the rules are a little different, Bob. In the Senate, we have Senator Robert C. Byrd, who, if he didn't invent reconciliation, certainly reinvented it, and we need to play by those Senate rules to bring this to completion.
And do you think you can do that this week? Do you think this will be done this week? And
we'll start it this week.
And what do you do when the Republicans, Senator McConnell, he was playing his cards very close to the vest this morning, as you heard, but he said we're prepared to introduce amendments. This could go on, as we know in the Senate. There can be amendments and amendments and amendments. How do you bring that to a close, if in fact you can?
It's never been tested. You know, the purpose of reconciliation is to avoid the filibuster. The filibuster is an effort to talk something to death. And in this case, the Republicans are going to try to use reconciliation, which was supposed to be a more direct process, to offer amendments to a breaking point. Well, I certainly think that we're ready to tackle that if that's what they want to do. We're going to deal with honest amendments on substance that meet the test of the Senate rules. But there's going to come a point when the American people and the people in the Senate are going to say, this really isn't about substance. It's all about politics. Now let's make a final decision. Up or down vote. Do you want to change the problems we face in health care today? And it's certainly a majority of Democrats do. Or do you want to stand by the health insurance companies and keep the problems we have going? And I'm afraid that's where the Republicans are.
So just one more time I want to ask you, you think this legislation will be ready for the president to sign this week?
Well, I can't say what the parliamentary rulings will be on every provision, but I can tell you that we have a majority of the United States Senate ready to vote for the reconciliation bill to move this forward for the president's signature. If there is some procedural problem we run into, we're going to work through it. We are determined to get this done. The Republicans want us to quit and stop and don't try anymore. We're not going to do that.
All right.
We owe it to the American people to finish this job.
All right. Thank you so much, Senator. And I will be back in a moment with some final thoughts. Finally, today, Washington's always been a one-story town, and for the last few weeks, months really, the story has been health care reform. It's all we've been talking about around here, which is probably one reason a rather important anniversary passed without much notice. March 19th. Ring a bell? Probably not. But March 19th was the 7th anniversary of the Iraq invasion, which began our longest war. A heavy news cycle was not the only reason it went unnoticed. We remember the wars and events that had an impact on our daily lives, December 7th or 9/11. But in the age of the all-volunteer military, few of us remember much about a war that had so little effect on our day-to-day lives, especially a war where questions still exist over whether it should have been fought at all. The Iraq War was fought by 0.5% of us, and unless we were part of that small group or had a relative who was, we went about our lives as usual most of the time. No draft, no new taxes, no changes. Not so for the small group who fought the war and their families. Ask them about the sacrifice, the death toll of nearly 4,400 Americans, and the thousands more who were wounded. Now that it is finally winding down, thousands of Americans are still there, and history will eventually decide if it was worth it all. While history decides, let us remember that whatever history's verdict, the fate of those who died there or suffered life-altering injuries can never change. Good war or bad, for them, it is the same. The war may have had little impact on most of our lives, but we owe that small group of people. Back in a minute.